Hey, beautiful people. So today I want to talk to you about something that I've introduced in my practice that I'm absolutely in love with. As you know, I am an integrative anti-aging practitioner, and I love having the latest and greatest. I am not a plastic surgeon, I'm not a derm, not a cosmetic surgeon, I'm a primary care. That's how I've been trained. And I chose that because I love continuity of care. I love being jack of all trades. But what most of you don't know is I actually did want to be a surgeon, and I loved rotating through those specialties, and I'm just really good with my hands, and I love those kind of little procedures. So I have aesthetics in my practice, and I'm able to do all those types of things. And one procedure that I love doing are PDO threads. So that stands for polydioxanone, and what they are, they're basically medical sutures that have been used for decades in surgeries. They are absorbable, they're dissolvable, they're hypoallergenic monofilaments. They are FDA approved for skin tissue approximation, and you can use it on the face, you can use it on the body. So it's gained a lot of headway and popularity in America. It's been used for a while actually in Asia, especially Korea. They're really into skincare and beauty. But the ones I use are a specific type, and there are three. They are barbed wire, smooth, and twist. So you can use them as needles, where the wire or the sutures actually wrapped around the needle, and you use a 27 gauge, 29 gauge, 30 gauge. They're very itty bitty small needles, and they are inserted just under the skin, and they stimulate collagenesis, which is new growth of collagen, which as we age basically kind of disappears. We lose the fat pads in our face, gravity takes toll, and everything starts sagging, and we start hollowing out. So a lot of people do several different things. You can do fillers, you can do microneedling, you can do surgical facelifts, and basically you want to use a combination of things. But there are people who just never want to have surgery, and you want to do things in a more natural way, to tweak yourself in a natural way. And what's really gained so much popularity, like I mentioned, are non-surgical PDO threads. And you can do basically non-invasive facelifts. You can use it anywhere in the body, like your elbows, your knees, for crepey skin, your abdomen, your glutes. So it's really fascinating. And I'm going to show you, actually, I have a little book here that I just kind of want to show you visual. There are three types I told you, and the smooth and the twist threads are actually the needles, and the threads are wrapped around the needle, and like I said, they're very small. Now I'm going to demonstrate it on myself, so I'm going to warn you, if you don't like watching needles in the skin, turn this off right now. Don't watch the rest of the video. But I'm going to tell you it's painless, and these are no downtime, virtually no downtime. You can actually come in for a lunchtime procedure, get it done, walk back out. There's really no effects. No one will ever actually know you had it done. Like, you can go back to work and be like, oh, hi everyone, I'm back. So I'm talking about the smooth and the twist, which I'm going to actually demonstrate. I think I have the smooth here, and I'm going to show you some pictures before I do it, so you kind of get an idea of what I'm talking about and where. I just wanted to do this to demonstrate to you that you don't have to be scared, because it's not painful at all. The barbed wire is a little more involved because you use an 18 gauge needle. I know it sounds kind of big, but use an 18 gauge, and I do numb it with lidocaine. And it is a blunt tipped cannula that actually has a barbed thread. Kind of think of little fish hooks. They're very little. And you insert it into the skin and the subcutaneous layer, and then you pull it out, and the sutures actually stay there, and over weeks and months they start dissolving, and they start creating new collagen growth. It's a biostimulatory effect, and it draws in the moisture because of the swelling. It helps with vascularization, so you get new blood flow, lymphatic flow. So I wanted to show you, these are the smooth, as you can see, and you have basically the needles, and then the threads are kind of wrapped around it, right? And then you have the barbed. So that is the blunt tip cannula, and you basically insert that through a hole that's made in the skin, and then you pull it out, and then it kind of creates like that instant facelift. So areas, this is a really great diagram, and I want to show you. So basically, okay, this is gonna be a combination of everything. So if you look at this, you have, I'm going to see the smooth, the twist, and then the barb. So it's color coded, okay? And then what you're going to do is, it's kind of hard for me to do this because I'm looking, okay. So the smooth is going to be the purple. So these are the areas you can use to smooth. You can do it in the tear troughs. You can do it up in the glabella. Never, ever. if someone tried to pay me like $1 million to inject filler in their glabella, where your 11s are, where you typically like do like Botox, I would not do it because you can risk blindness. That is a very vascular area. Now, danger zones of the face are pretty much everywhere. So there's no safe area on the face. However, you definitely want to know the anatomy of your face when you're doing things like fillers, because you have a needle that can go and hit an artery, you can occlude it, and you can get necrosis, and that is not a good thing. So there are always going to be risks. And then you have the twist, and you can do the twist over there in the glabella, you can do it in the lips, you can do it in the marionette lines and the nasolabial folds. Now, the nasolabial folds are also an area that's highly vascular, and really all the arteries and all the vascularization in the face lead to very critical areas. So blindness is always a result, necrosis is always, or potential side effect, not result, potential side effect. So you have to be super careful. Always go to an experienced injector. Try not to do stuff on your own. And this, I'm mainly talking about fillers. Things like neuromodulators like Botox, Xeomin, those are very short needles. You're using insulin syringes. Things like threads, the risk is really not there because you're not penetrating deep down there. So I just wanted to let you know. Now, barbed, or the barbed thread, that's where typically you want a nice kind of pull. So you can do, the eyebrow lift is huge now. It's the snatched look where you can create the hole there, put it through, and you kind of create that like cat's eye look, which you see a lot of models like Bella Hadid, Kendall Jenner, they're all kind of sporting that look right now. You know, and too much can be too much. You know, you don't want to make it look like you went through a wind tunnel, but you know, to each his own. Threads provide a very natural way to give you a little tweak without being so obvious. And then you can also do the neck. I've done the neck a lot too, and you can pretty much do the smooth or the barbed there. But again, these are just general rules. And so you want to always have an aseptic technique. And I've already cleaned my face with alcohol. I'm just going to show you here. And I obviously have eyeliner and lipstick on because that's the only makeup I wear. And well, a little eyeshadow I think I have on today because I was doing a video. But this is all clean here. I don't wear foundation. I don't do anything else. And actually, I'm going to be looking in a mirror. I have a little rosacea flare up today for some reason. So I am going to look in a mirror while I'm doing this instead of in the camera. But I have my gloves. Like I said, I've already cleaned my face. And today I'm going to be doing a smooth needle technique. So kind of comes in a package like this. And here's a needle. Again, if you don't like needles in the skin, then I wouldn't really watch this. But so this is how small it is. See it? And they have a little indication here where you're going to face it up. So you're going to kind of go parallel. So again, you pick a spot. I'm going to do it here. So you kind of want to have a mesh effect too, because like it's biostimulatory, so you're able to like produce more collagen. So I'm going to, here you know, the cheekbone. So you pick an area and you basically just go under the skin. You can pull back a little. And you go, kind of keep it parallel, push it in. This does not hurt at all, by the way. You can kind of see it, but you don't want it to be too superficial. And you can actually just leave it there. I know it looks a little weird, but I want to show you that it's not painful at all. So I have my second one. And again, I'm going to just kind of do this a few times just so you can get an idea. And then I'm going to do another one here. And I'm going to kind of parallel. So I pull the skin back. This is a 27 gauge. So you can even go smaller. You can do 29 gauge, 30 gauge. So I have that. So 4 comes in this pack. So I'm going to create like a crisscross hatched kind of look here. So I don't know again if you can see it, but you can see this, sorry, no, it's hard to see, but there's a thread that's attached there. So then I'm going to create like a mesh effect. Okay, there you go. It's really easy, and I'm telling you, it's not painful. I mean, yeah, I might have a high tolerance for pain, but still, I'm telling you, I wouldn't lie to you. So I've had a lot of patients do this and they did great. Just go, you push it in, that's it. And then you can twist them, twist it, and then you just pull it out. That's it. Pull it out. That's that. Then I'll twist this and then pull it out. Now, I do have to say, that's it. I don't have even any bleeding or anything like that. So I do have to say, just always talk to your practitioner about it. Make sure you understand, you know, the pros, the cons, what else you need to do. There's no single thing that's going to completely change. We have to do probably a conglomeration of things. But I just wanted to show you that threads are an awesome way to help with some natural collagen stimulation, and in conjunction with doing things like RF microneedling, skin, you know, laser resurfacing, maybe neuromodulators or fillers. Now, I don't do neuromodulators or Botox or fillers, not yet, at least. I might one day. But for now, I think I want to try this and maybe see over time. So this is something that I would recommend to a lot of patients. If you want more information, make sure to go to my website, or you can call Synergistic at 727-754-2936. And I hope you have a great evening. Bye.